Doc, good morning to you. What happened?
Good morning. It's a general problem that we have in all our ICUs across the country and across the province, where we deal with a lot of bacteria and bugs that needs toilet treatment. And because of the factors, again, that relates to overcrowding, which is a big problem across our province in terms of our ICU toilet status. So besides all that, I think the other problem is that we have a number of women who deliver preterm and prematurely.
You speak about overcrowding in hospitals. That suggests to me that perhaps a human element may have in part played or may have been a factor in what happened here.
Yeah, I think the basic thing that we need to talk about here is that ICUs are usually sterile areas, and people that enter the ICU should properly wash their hands and also maintain a bit of barrier management in terms of seeing patients. And because of overcrowding and our staff shortage, we faced a situation where one nurse would have maybe looked after more than two babies.
Why was this information kept under wraps?
No, it was not kept under wraps. I think the issue is that we have to manage situations first before we blow things out of proportion. And the other thing is that we have to culture the bug, because you cannot go out and talk about something that you are not sure of. And in terms of culturing the bug, it takes a lot of time, and we then had to get into a space where we are able to manage the situation, and currently everything is manageable and we are doing a good progress.
So in total, how many babies died?
10.
10 babies died.
Yeah.
And the families of these infants, are they going to have some kind of legal recourse against the health department?
I'm not sure about the legal recourse. Let me not comment about it. But what I could say that the parents and the people involved have been properly counseled. And here we're talking about babies who are quite vulnerable, preterm babies, which in many instances they are quite vulnerable to infections. And yes, the other thing is that yes, when we have a number of babies in one ICU, we cannot close off the ICU because the numbers and the demand for the ICU service is actually tremendous. And the only thing is that we just have to make way and make shift of what we have.
And what is the report from the staff who were in service during these two critical months, November and December? What is the report coming out of there saying to you?
The thing is that we have been putting up a lot of infrastructure changes across the province in most of our neonatal ICUs. And the thing is that the staff has been struggling to get hold of the infection and control it. And I think that one of the problems, like I've mentioned here, which we have not hidden, is that the overcrowding is the biggest problem that we face.
Let me say again, you're pointing to human error. People surely have the legal right to sue the department.
Yeah, that's why I'm saying that let me not comment about it. They do have the recourse, but I think we will explain the situation and we will explain how the circumstances we are facing as government and as the department. And also there are other factors that we need to take into account, because ICU situations, it's not only health workers who enter the ICU, even the parents of the babies do enter, and if there's not properly issue of hygiene and hand washing is done, then we have this problem. And I think that we need not to be in a space where we blame one person over another, because the system itself needs to be sorted out. We need to build more neonatal ICUs. We need to run campaigns against flippant usage of antibiotics, which leads to resistance. We need to run a campaign about hygiene of hand washing. We also just need to run a campaign to prevent preterm labor and preterm deliveries, because that's where most of this problem stems from. So we need, I think, part of this discussion and this part of this discourse that we're having, it should be to raise the awareness amongst our people, amongst the public, on the several factors that leads to this problem.
Certainly, that's a major admission on your part, MEC. Thank you very much for your time. He is the MEC of Health in the Gauteng province, Dr. BANDILE MASUKU. Jane?